The theme of the day is health for all. So actually it's about universal health coverage and equity and how health systems around the world can accomplish this goal.
Now more than ever, about the Lancet.
I had a talk about erosion of social security in Europe. So I started with an introduction about how social security started in Europe, actually almost 150 years ago, when the industrialization came into Europe. Workers started organizing and started building up small systems of social security to support their colleagues who became ill or who lost their job. And actually throughout the 20th century, every time, step by step, every time that there was a big social struggle or a general strike, the social security systems have expanded. But we see that since the crisis of the 70s and the neoliberal policies that have dominated European politics, the social security systems are being broken down again.
It is clear that for those systems,
the social security system, as it has existed in Europe, was a very good thing to accomplish health for all, because it's a form of solidarity where healthy people support the sick people. But it can only be accomplished by social struggle. I think that's my most important message. And well, just that we, as the workers in the 19th century and the beginning of the 20th century, we should rise again to defend our social security system, because neoliberal politics is breaking it down as we speak.
Immediately after the end of the session,
Salvador has a health system which is mixed. It is fragmented and broken up. It is mainly for those who are signed up to the social security system. These are those who have stable jobs, mainly in services, industry, or the state, working for the state. Other people are covered by the public health system, and this is a network led by the Ministry for Health. A small proportion are covered by other insurance schemes, particularly teachers, covered by the ministerial system and the army. I'm here because I'm a health activist. I've been participating in the People's Health Movement since it began in 2000 at the First Assembly in Bangladesh. I have also been part of the organizing committee for the Second Assembly in Cuenca, Ecuador in 2005. Today I'm participating under a different role. This is because I have now the responsibility of the Vice Minister for Health in my country. This means that I am not able to take part in the same way as before, but I have been in the movement since the beginning and I will always be there. I believe that the People's Health Movement is one which is very inspiring, it is innovative, and it is giving new hope to all populations around the world, and it is leading us in the right direction in order to achieve health for all.
it is clear that for those systems,
the health situation is not easy. The system, all social systems, infrastructures, they went down since the beginning of 90s. After the fall of the Soviet Union, there was a budget deficit, there was hyperinflation, and we have lost a lot of human resources. So it's quite uneasy. And concerning the women's health, I can tell that the maternal mortality rates are still high, and although we target Millennium Development Goals and decrease in the maternal mortality rates and also child mortality rates, these are not easy goals to achieve. I decided to come to the People's Health Assembly because I feel that this movement has a lot of potential to develop, and it has a lot of potential to influence situation on the global level as well on the national levels, and of course with the activists on the local level. The thing is that we don't know much about the social movements, global social movements, and we still have to learn a lot, but also to give a lot, because we have quite different system of healthcare, and we are different people with different background and education and everything.
I came here to get to know a lot of people and also to get the right spirit, right? So, I mean, all these topics where we're talking about, we already know them. They're also in the Global Health Watch report, so that's not why we should come together. We should come together to share experiences of how in our own country, as an activist, we try to accomplish this theory into practice.
I wish, and it should be a demand at the People's Health Assembly, to look on the rights of migrants, look at the rights of asylum seekers, the rights of refugees, that documentation is a problem. They should take it as an issue and see that if people are properly documented, it won't cause any harm into this country, and it will help them to assess help much more better, just like other human beings.
In the first PHA and in the second PHA, we try to have an analysis of the problem, identify the problems and etc. Here my expectation is that from here we can have some action programs, that now we know the problems, we have identified the problems, but what action we are going to take to improve the situations. So it will be a more practical, action-oriented outcome. That is what is my expectation, at least from here.